Good morning, I'm Katarina Lukitich, and this morning we are taking 5 with Dr. James Morgan of Medical Center Podiatry. Thanks so much for joining us this morning.
Thank you for having me.
So today we're talking about bunions. Explain what a bunion actually is.
A bunion is essentially a deformity of the big toe, and it affects primarily women over the age of 60, but it can also affect men as well as adolescents. And in essence, the deformity originates from an instability at this joint, joining this long bone to the middle part of the arch. And that instability creates a gap between these two long bones and the big toe turning in. So it gives the appearance of a knot, but it's actually a much more involved deformity involving 3 dimensions.
It can be painful and it can be uncomfortable. So if someone has a bunion, what options are they looking at?
Initially, upon coming into the office for evaluation for a bunion, x-rays are taken, the foot's evaluated, and conservative treatment is typically recommended initially, which involves changing to wider shoes, softer materials, certain pads that can protect the bump, as well as orthotics to help to control the pressure around there. But at some point, most patients do wind up to the surgery stage there. And traditionally, the bunion correction that has been primarily used by most surgeons is a 2-dimensional osteotomy, where you basically cut this long bone and shift it over to close that gap. The only problem with that is it doesn't fully reduce the deformity, it only corrects for 2 dimensions, but the biggest thing is it does not correct this instability at this joint. So this definitely leaves the door open for a possible recurrence.
Now there's a different procedure called Lapiplasty. What is that?
Lapaplasty 3D bunion correction is kind of a new take on an old procedure that basically involves a set of instruments which help to make the procedure a lot more efficient and more precise. And the other big part of it is this procedure typically in the past has been something that would require about 8 to 12 weeks of no weight whatsoever on the foot, which that can be difficult for some people. With this one, because of the patented plates, 2 titanium plates, and the position of these plates, the patients can actually begin to bear weight within 1 to 2 weeks with a walking boot, protective boot.
Well, Dr. Morgan, thanks so much for joining us this morning. If you're at home and you have a bunion and you're looking to get a little bit more information, you can either go to fixmytoe.com or you can go to medicalcenterpodiatry.org. Dr. Morgan, thanks again so much for joining us this morning.
Thank you.